You probably know about gout. If you don't, you're about to find out. Gout is a kind of arthritis that can cause burning, swelling, or stiffness in joints, usually the big toe. It can even cause harm to tendons, joints, and other tissues, and it's usually common in men and can happen over and over again unless treated. Enough of my face. Let's get to the fun part. Cue music!
I was trying to figure out what to do about my app. My father was homesick trying to figure out how he got the gout.
Oh, baby, when did you get the gout?
I don't know. It just happened.
I know you're probably wondering, what is the gout?
Well, gout, or the gout, as some people like to call it, is a form of arthritis, which causes severe swelling, usually in the ankle or the big toe. It's caused by a poor diet, including things like smothered pork chops.
Need some salt.
Smothered chicken fried bacon,
Need some salt.
and smothered chicken fried bananas. Not bad.
Need salt.
Are you out your damn mind?
All right, I'm going to work the phones over at the real estate office today. Try not to eat any junk. I'll be home in time to make dinner.
I can't eat that stuff all day.
You can if you want to get rid of the gout. Give me a kiss.
To understand gout, you first must understand what arthritis is. Arthritis comes from the Greek meaning inflammation of joint, arthro meaning joint or jointed, and itis meaning inflammation of. Gout comes from the Latin word gutta meaning drop. Gout is caused by too much uric acid in the blood. Most of the time, having too much uric acid isn't harmful. Many people with high levels in their blood never get gout. But when uric acid levels in your blood are too high, the uric acid may form hard crystals in your joints. Your chances of getting gout are higher if you are overweight, drink too much alcohol, or eat too much meat and fish that are high in chemicals called purines. Some medicines, such as water pills, can also bring out gout. The most common sign of gout is a nighttime attack of swelling, tenderness, redness, and sharp pain in your big toe. You can also get gout attacks in your foot, ankle, or knees or other joints. The attacks can last a few days or many weeks before the pain goes away. Another attack may not happen for months or years. Your doctor will ask questions about your symptoms and do a physical exam. Your doctor may also take a sample of fluid from your joint to look for uric acid crystals. This is the best way to test for gout. Your doctor may also do a blood test to measure the amount of uric acid in your blood. To stop a gout attack, your doctor can give you a shot of corticosteroids or prescribe a large daily dose of one or more medicines. The doses will get smaller as your symptoms go away. Relief from a gout attack often begins within 24 hours if you start treatment right away. To ease the pain during a gout attack, rest the joints that hurt. Taking ibuprofen or another anti-inflammatory medicine can also help you feel better. But don't take aspirin. It can make gout worse by raising the uric acid level in the blood. To prevent future attacks, your doctor can prescribe a medicine to reduce uric acid buildup in your blood. Paying attention to what you eat may help you manage your gout. Eat moderate amounts of a healthy mix of foods to control your weight and get the nutrition you need. Limit daily intake of meat, seafood, and alcohol, especially beer. Drink plenty of water and other fluids. Let's go into a little more detail without all the words. Gout is a kind of arthritis caused by a buildup of uric acid crystals in the joints. Uric acid is a breakdown product of purines that are a part of many foods we eat. An abnormality in handling uric acid and crystallization of these compounds in joints can cause attacks of painful arthritis, kidney stones, and blockage of the kidney filtering tubules with uric acid crystals, leading to kidney failure. Gout has the unique distinction of being one of the most frequent recorded medical illnesses throughout history. Acute gout attacks are characterized by a rapid onset of pain in the affected joints, followed by warmth, swelling, reddish discolorization, and marked tenderness. The small joints at the base of the big toe is the most common site for an attack. Other joints that can be affected include the ankles, knees, wrists, fingers, and elbows. In some people, the acute pain is so intense that even a bed sheet touching the toe causes severe pain. These painful attacks usually subside in hours to days, with or without medication. In rare instances, an attack can last for weeks. Most people with gout will experience repeated bouts over the years. The prevalence of gout in the U.S. has risen over the last 20 years and now affects 8.3 million Americans, roughly 4%. Gout is more common in men than in women and more prevalent in African American men than white men. The chances of having gout rises with age, with a peak age of 75. In women, gout attacks usually occur after menopause. Among the U.S. population, about 21% have elevated blood uric acid levels, a condition known as hyperuricemia. However, only a small portion of those with hyperuricemia will actually develop gout. If your parents have gout, then you have a 20% chance of developing it. Obesity, especially in youth, moderate to heavy alcohol intake, high blood pressure, and abnormal kidney functions are among the risk factors for developing gout. Certain drugs and diseases can also cause elevated levels of uric acid. Also, there is an increased prevalence of abnormally low thyroid hormone levels in patients with gout. The joint at the base of the big toe is the most common site of an acute gout attack. These attacks can reoccur unless gout is treated. Over time, they can harm joints, tendons, and other tissues. People may experience gout with deposits of uric acid crystals in their finger joints. To ease the pain during a gout attack, the best idea is to rest the joint that hurts. Gout can also attack joints such as the elbows and knees. You can see this by the protrusion on the elbow in this picture. Gout is considered when a patient reports a history of repeated attacks of painful arthritis, especially at the base of the toes or in the ankles and knees. The most reliable test for gout is detecting uric acid crystals in the joint fluid obtained by joint aspiration. This common office procedure is performed with topical local anesthesia. Using sterilized technique, fluid is withdrawn, or aspirated, from the inflamed joint with a syringe and needle. Once joint fluid is obtained, it is analyzed for uric acid crystals and infection. Maintaining adequate fluid intake helps prevent acute gout attacks and decreases the risk of kidney stone formation in people with gout. Alcohol is known to have diuretic effects that can contribute to dehydration and precipitate acute gout attacks. Alcohol can also affect uric acid metabolism and cause hyperuricemia. It causes gout by slowing down the excretion of uric acid from the kidneys, as well as by causing dehydration, which precipitates the crystals in the joints. Dietary changes can help reduce uric acid levels in the blood. Since purine chemicals are converted by the body into uric acid, purine-rich foods should be avoided. Foods rich in purines include shellfish and organ meats, such as livers, brains, and kidneys. Researchers have reported that meat or seafood consumption increases the risk of gout attacks, while dairy consumptions seem to reduce the risk. Weight reduction can be helpful in lowering the risk of recurring attacks of gout. Certain medications reduce the pain and inflammation of gout attacks, such as anti-inflammatory drugs like ibuprofen and corticosteroids. Other medications decrease the level of uric acid in the blood and prevent the deposit of uric acid in joints, the kidneys, and in tissue, helping to prevent further attacks and complications. These drugs include other hard-to-pronounce scientific names such as allopurinol, febuxostat, lesinurad, and probencenid. And to sum up our college education, time for a question that was never on lecture that you're still expected to know. And if your answer was D, Popliteus, congratulations! You still have a lot of studying to do because the answer was Extensor Hallicus brevis. And just to make sure I don't get sued, here is my bibliography. That's all, folks. Today we'll be talking about and
Big white beans.
fancy meeting you here. Well, while I'm here, I might as well give a presentation. Gout is
Black Beatles in the city, be back immediately to confiscate the money.